Welcome to the C-Spine Precautions Education module. Approximately 1,600 trauma patients are admitted to our Level 1 Trauma Center per year. Of those patients, 500 to 600 present with a mechanism of injury requiring C-spine precautions until medically cleared. Our statistics show the incidence is twice as high among men, with their average being 45 years old. The following topics will be addressed in this learning module. These are some of the mechanisms of injury we see in our patient population. Understanding the mechanism of injury helps to guide assessment and interventions in trauma care. MUHC C-spine orders. All patients with a suspected spinal injury will be put on C-spine precautions until cleared by the appropriate medical team. A doctor's order is needed to put a patient on C-spine precautions and to discontinue C-spine precautions. Ensure that section 1, 2, or 3 is filled out on the pre-printed order sheet and that the form is signed by an attending or a resident working with the trauma population. For those of you working in ER, you will go to MEDURGE to enter your orders. If a doctor wants full C-spine precautions, they will need to select Level 1. Details of Level 1 precautions are on the back side of the sheet. An order sheet must accompany the patient from eMERGE when admitting to a unit. For nurses working in the emergency department, the doctor will fill out C-spine precautions in the MEDURGE program. C-spine precautions include: your patient should be on complete bed rest with no bathroom privileges and no pillow under their head. They should be wearing a proper fitting collar at all times. The bed should be flat or in reverse Trendelenburg position. The patient should be on a mattress which supports spinal alignment. The patient should be turned and positioned every 2 hours using log rolling technique. The patient may be left on their side with a wedge or pillow to support their spinal alignment, and a small towel or piqué can support their head while on their side. For Level 2 precautions, full C-spine precautions are DC'd, but your patient must still wear a collar at all times. Your patient will no longer require to be flat in bed or to have their head and neck immobilized when turning. The doctor will specify the appropriate activity level on the order sheet. The following are the defined activity levels in the MEDURGE program. In Level 3, the patient's C-spine will be cleared, the C-spine precautions discontinued, and the collar removed. This can only be done by an attending physician or orthospine fellow. Before C-spine clearance, both clinical and radiological clearance must be performed. Clinical clearance is defined as no cervical pain or tenderness on palpation or on range of motion, including flexion, extension, and rotation of the neck. Radiological clearance is defined as an X-ray or a CT of the C-spine, which has been assessed by a radiologist and is shown to have no injuries. Your patient may have lower spine injuries and still require to be turned using the log rolling technique without someone having to hold their head. A patient may move from level 1 to level 3 without requiring level 2 if they don't require a collar for a prolonged period of time. For the nurses in emergency, the doctor will check off box 3 and the appropriate interventions in MEDURGE. At this point, your C-spine precautions have been discontinued and the collar can be removed. MUHC C-spine protocols will be reviewed individually. We will now look at fitting and application of the C-spine collar. If your patient in C-spine precautions arrives with an Urgences Santé Extrication collar, it must be replaced within 24 hours by a Miami J collar. Here is the Miami J collar. It is the chosen collar used at the MUHC. Your patient may be required to wear this collar from a few days to several weeks. The angulation buttons may be used to fine-tune the fit of the collar, both front and back, for better anatomical conformity, pressure distribution, and comfort. In selecting the correct collar for your patient, use the above poster to match the size and shape of your patient's neck. There are 6 phenotypes to choose from. The above 3 are the most common. In less than 30% of the population, you may be required to use a specialty size. Prior to removing the extrication collar, the head and neck must be immobilized. This may be done by nurses, occupational therapists, physiotherapists, physicians, or respiratory therapists. In order to immobilize the head and neck, we will use the occipital mandible hold. Your 2 thumbs will be positioned over the mandible, and your fingers will be spread open behind the head and over the occipital notch. Prior to removing the extrication collar, with the bed flat and the patient in a supine position, the nurse will explain the procedure to the patient. Before manipulating the collar, a brief motor and sensory assessment must be performed. If the patient is able to communicate, ask the patient to wiggle their fingers and toes and determine if they are experiencing any numbness or tingling in their extremities. If any of these symptoms are new, please notify the doctor before manipulating the patient. While the patient's head and neck are held in a secure position, a second person will remove the extrication collar. The Velcro strap is undone and the collar is slid carefully under the patient's head and neck. The leader will maintain the alignment during this process. With the appropriately sized Miami J collar, slide the back of the collar under the patient's neck and shoulders as the leader holds and immobilizes the head. While applying the front of the collar, flatten it out and scoop it under the chin so it fits snugly in position with the chin resting in the chin support. While fastening the collar, bring the Velcro straps forward from the back of the collar and fasten them snugly enough that the chin cannot fall back into the collar. Ensure that no plastic is touching the patient's skin. Following the collar application, repeat the motor and sensory assessment to ensure there has been no change. The following video will review the application of the Miami J collar. Hi Rachel, my name is Julie.
Hi.
I understand you've had a fall?
Yes.
You fell off a ladder
Yes,
earlier
I fell.
this morning? How are you feeling?
I'm feeling okay. Just my neck hurts a bit.
Okay. The collar that you have on right now was put on by Urgences Santé, and I'm going to change that collar now. Before I do that, I just want to ask you a few questions. Can you just wiggle your fingers for me? How about your toes? Do you feel any numbness or tingling in any of your hands, fingers, toes, feet?
No.
Anything
I feel
unusual?
fine. I feel good.
Okay. So in sizing Rachel up for her Miami Jade collar, I'm going to look at this poster and establish which phenotype would be for her or her size. The most popular sizes for adult females are the 400 regular and adult males the 300 short. So I believe that Rachel is a normal adult female size, and I would choose a 400 regular for her. Okay, Rachel, so now I'm going to put your new collar on. I'm going to hold your head as I was earlier. The back of the collar goes on first, and it goes underneath your shoulders and your neck. The back of the collar actually has an arrow on it to show which way is up. And then the front of the collar, we're going to flatten it out and scoop it under your chin so that it rests properly under your skin, under your chin. Then the Velcro straps will come forward on top of the front of the collar. And we'll make sure that it's snug enough that it's not too tight. We can get a couple of fingers underneath the collar, and you can tell me how you feel with that.
Okay.
Okay? I want to make sure that all of the blue foam is under the plastic and so the plastic isn't touching your skin. And that your ears aren't caught in the collar. And that your collar is centrally situated right down the middle of your body. How does that feel?
Yeah, I feel good.
Good. Now again, I'd like you to wiggle your fingers for me and wiggle your toes. And again, is there any unusual sensation, any numbness?
No.
Nothing. Great. Okay, so now your collar is adequately applied. This section will now review turning and positioning a patient in C-spine precautions. As mentioned, patients on C-spine precautions must be turned and positioned every 2 hours to prevent pressure sores. To do so, you require a minimum of 3 people for the turn and 1 person to place the pillows or wedge. While the patient is turned on their side, a 4th person can inspect the skin, bathe the back, and position a wedge or pillows to support the side lying position. To prevent skin breakdown, it is important to turn and reposition your patient every 2 hours. Patients should be left on their sides for the period of 2 hours if tolerated. A folded flannel, towel, or piqué can be used to support the head and neck while on their side. Once again, a repeat motor and sensory assessment must be done following any repositioning of your patient. This video will demonstrate turning and positioning of a patient in C-spine precautions. Okay, Rachel, now we're going to turn you on to your side and we're going to position you on that side for a couple of hours.
Okay.
So again, I'm going to hold your head with my fingers behind your head and my thumbs up over your jaw. Before we do roll you, again, I want to ask you those couple of questions. Can you wiggle your fingers? Can you wiggle your toes?
Yeah.
And do you have any strange, funny sensations of numbness in
No.
toes or fingers?
No.
Okay, super. So again, I will hold your head, and the two people at your side will position their hands such that they can roll you like a log, all in one piece. And I will lead the turn. So on 3, we'll turn Rachel onto her right side. Everyone ready?
Mm-hmm.
1, 2, 3. There we go. You okay?
Yeah.
Okay. While you're here, we'll position some pillows so that you can lean up against them, but still keep your body in full alignment. At the same time, it's an opportunity for us to look at your skin on your back because you've been lying for a couple of hours on that back. Looks good?
Nothing bad.
Feeling okay?
Mm-hmm.
Okay, we'll slightly, on the count of 3 again, just let you relax back onto the pillows. 1, 2, 3. Here you go, keeping you in alignment. We've put a little piqué under your neck to keep your head in alignment. Do you feel comfortable?
Yeah, I feel great.
Okay, and again, one last neuro assessment. So again, fingers, toes, any unusual sensation?
No.
Okay. Okay, Rachel, we're going to just now tilt your bed at 30 degrees. The bed has to remain flat. And your head will be about 30 degrees higher than your feet.
Thank you.
Comfortable?
Yeah.
When transferring a patient from bed to stretcher or stretcher to bed, use the soft plastic transfer boards. Use the log roll technique when placing the board under the patient. Important skin assessment for vulnerable pressure points. Collar care and a skin assessment must be performed every 8 hours with someone immobilizing the head and neck. Start by removing the front of the collar, then wash and dry the skin thoroughly. Once the front of the collar is reapplied, the patient should be log rolled on their side with someone supporting their head. The back of the collar is then removed, and the back of the head and neck should be carefully examined for any skin breakdown. The skin is then cleaned and dried before reapplying the back of the collar. The following video reviews collar care. Okay, Rachel, I'm going to do your collar care now. This has to be done every 8 hours. And what we'll do is remove the collar, clean the skin on your neck, and have a look at the skin in order to see whether there are any pressure areas or areas that we have to deal with. So I'm going to hold on to your head again, keep it stable with my fingers behind your head and my thumbs on your chin, and we'll remove the front of the collar first. But before I do that, I want again to ask you to wiggle your fingers, wiggle your toes, and ask you if you have any unusual sensation.
No, I'm okay.
In either of those limbs. Nothing?
No.
So we'll remove the front of the collar and have a look at your skin, looking at the front of your chest, the top of your shoulders, underneath your chin, just to see if there's any redness in those areas. We'll clean your skin and dry it well before putting on the front of the collar. Again, using the same technique, we'll flatten out the front and scoop it underneath your chin, so we put it at the right place under your skin, and then secure it with the Velcro straps, making sure that we're equal on each side and that the front of the collar, the chest plate, is going down the middle of your body. Okay, now we'll have to turn you on your side so we can open up the back of your collar and have a look at the back of your neck and also clean it. So put your hands over your chest, and we'll use the same log roll technique with two people on the side and their hands strategically placed so that we keep your body in full alignment as we turn you. Everybody ready? On the count of 3. 1, 2, 3. And now to look at the back of the neck, we're going to pull the collar down, just releasing one side. And this way we have a look at the skin on the top of the back, and the back of the neck, and also on the back of the head where frequent pressure sores can arise. So we just, again, we'll clean the skin and dry it well, and then replace the collar. Bringing the collar back over the front of the collar and reattaching the Velcro strap. Again, making sure that the collar is centered in the back of the patient's back and that it's not too high up on the back of the head. Please assure that the following pressure points are assessed: collar cleaning and maintenance. Important highlights in collar cleaning and maintenance. Hand wash the collar and pads with mild soap and water every day. Rinse the pads thoroughly and let air dry on a flat surface. An extra set of blue replacement pads come with your collar. Replace the pads if they become worn or start to separate. Important reminders. Do not use bleach, dish detergent, or harsh chemicals to clean your pads and collar. Avoid using powder as it will absorb perspiration and become pasty, making the pads difficult to clean. Documentation and extra forms. An individual hanger's prescription is required to reimburse your unit for the cost of the collar. A RAMQ form needs to be completed for each patient. This will allow the patient to get reimbursed for the cost of one hard collar and one soft collar. The following information must be documented: collar care, skin assessment, turning and positioning, motor and sensory function, patient comfort, C-spine precautions, maintained or discontinued, collar size and fitting, level of activity, and update the PTI and nursing intervention sheet as needed. Discharge teaching. It is important that your patient go home with clear instructions on how to care for their skin and collar, as well as any restrictions they may have. An assist strap comes in the package with the collar. Please keep it for when your patient goes home. It will assist them during collar care. Instructions for use are provided by the company in the packaging. Final summary. Ensure the C-spine orders are clearly written. If your patient has a collar, it should be properly sized and fitted. A neuro assessment should be done before and after manipulating the collar and turning and positioning your patients. Collar and pads should be cleaned daily. Skin assessment and hygiene under the collar should be done every 8 hours. Patients should be turned and repositioned every 2 hours. And ensure your documentation is complete.